The Untold Journey of Filipino Nurses in America. Filipino nurses have long been the quiet backbone of American healthcare, compassionate, resilient, and indispensable. Their story is one of dedication and sacrifice, woven into the very fabric of the nation's hospitals and clinics. Yet behind their tireless service lies a history marked by exploitation, discrimination, and overlooked heroism. The migration of Filipino nurses to the United States was never accidental. It was shaped by colonial legacies and strategic policies. After the U.S. colonized the Philippines in 1898, American-style nursing schools were established, producing a workforce fluent in English and trained in Western medical practices. This laid the foundation for a pipeline that would later be formalized through programs like the 1948 Exchange Visitor Program, which brought Filipino nurses to fill post-war shortages. The 1965 Immigration Act further opened doors, allowing skilled Filipino nurses to settle permanently and bring their families. By the 1970s, the Philippine government had institutionalized labor export, encouraging nurses to seek opportunities abroad as a national economic strategy. Once in the U.S., Filipino nurses quickly proved essential. They filled critical gaps in staffing, especially in underserved areas and high-stress environments. In California alone, nearly 18% of registered nurses are Filipino. Their presence has been especially vital during public health crises. During the COVID-19 pandemic, Filipino nurses were disproportionately represented in ICU and acute care units, often working grueling hours under dangerous conditions. Tragically, they also bore the brunt of the pandemic's toll. A 2021 study revealed that Filipino nurses accounted for 24% of COVID-related nurse deaths, despite comprising only 4% of the nursing workforce nationwide. This staggering disparity underscores the depth of their sacrifice. Yet even as they saved lives, Filipino nurses faced persistent challenges. Wage discrimination was rampant, with many paid less than their American counterparts and relegated to menial tasks. Racial and language biases further compounded their struggles. In one notable case, a group of Filipino nurses in California won a settlement after being told to speak only English at work, a directive rooted in prejudice rather than professionalism. Cultural tensions in the workplace often led to feelings of exclusion, especially in hospitals with high concentrations of Filipino staff. Meanwhile, professional barriers such as additional certification requirements disproportionately affected foreign-trained nurses, casting doubt on their competence despite years of experience. Beyond the hospital walls, Filipino nurses have also been active in labor and civil rights movements. Their advocacy for better working conditions, fair pay, and protective equipment has often gone unnoticed. Leaders like Zene Cortez have fought tirelessly to protect their peers, demanding dignity and safety in the workplace. These efforts, though under-recognized, reflect a legacy of courage and resistance. The story of Filipino nurses in America is not just one of service, it is one of endurance. They have weathered systemic inequities while continuing to care for others with grace and skill. Their sacrifices are not footnotes in history. They are testaments to a community that has given everything and asked for little in return. As we honor their contributions, we must also confront the injustices they've endured. Only then can we truly appreciate the depth of their legacy and ensure that future generations of Filipino nurses are met not with barriers, but with respect. As we celebrate American Filipino Heritage Month this October, let us not simply honor Filipino nurses for their contributions, but recognize the generations who endured hardship, discrimination, and sacrifice to earn the respect and dignity they have long deserved.